Here's a time-lapse map from the World Health Organization showing the spread of the coronavirus around the globe. And while the World Health Organization has warned of a possible worldwide pandemic, the United States still kind of figuring out what to do. Here's a couple of doctors from the World Health Organization in Geneva talking about precautions you can take if it shows up in your area.
So, Maria, what can people do to protect themselves if they're in an area where there's currently an outbreak of COVID?
So thanks, Margaret, for this question. This is a really important question because there's many things that you can do as an individual to protect yourself and to protect your family against this novel coronavirus. The first thing is very simple. The first thing is to wash your hands regularly. And it sounds very simple, it doesn't sound very exciting, but it is incredibly important that you make sure that you wash your hands with soap and water, and make sure you get your kids to wash their hands as well. And if you don't have soap and water, you can use an alcohol-based rub. That's the first thing. The second thing that you can do is what we call as practicing respiratory etiquette. And what that means is when you sneeze or if you cough, that you do that in a folded elbow, and you sneeze or cough into your elbow, or you use a tissue, and then you throw that tissue away, and then you make sure you wash your hands. And the third thing that is really important is to educate yourself. So make sure that you have the latest information about novel coronavirus, about COVID-19, from your parents, from WHO, from trusted sources, and make sure that you know what the latest information is about this. This is a rapidly changing situation, and every single day we are learning more and more about this virus. And so the more we learn, the more we want you to know about this. And by educating yourself, by knowing more about this, you can make sure that you protect yourself and you protect your family.
But it's not so easy, really, to always wash your hands, to keep those hands clean. And there's another secret, isn't there, Maria? How does the virus get into your body? Whereabouts is it getting there?
So yes, washing your hands is difficult, and it is something that you have to do many, many times a day. And as a mom myself, I know I tell my kids all the time to wash your hands and wash your hands regularly before you go to the bathroom, after you go to the bathroom, when you're cooking food, before you cook food, after you eat your food. You have to do that many, many times a day. But this is a respiratory virus. This is causing respiratory disease, which means that many people have signs and symptoms like the common cold almost. They'll have a fever, they'll have a cough. Some people may have shortness of breath, which means that their chest hurts a little bit and it's hard for them to breathe. But what we know about this virus is how it transmits between people is through close contact and through respiratory droplets, which means you have to be close to one another within a meter or two, which is 3 to 6 feet. And if I were to sneeze right now on you, or cough on you right now, I would pass some droplets to you. And those droplets could go into your eye, they can go into your mouth, into your nose. So you have to make sure that if you do cough, you cover your mouth so that those particles, those droplets, those little droplets don't actually infect someone else.
So when should people be wearing a mask?
So that's a good question. So there's a lot of people, WHO recommends that you wear a mask if you're sick. So if you have respiratory symptoms, what you do is you wear a mask, and there's important ways in which you put the mask on and off, and we have some good videos that show a proper way to put it on and off, but you're using a mask to protect other people. So if you have symptoms, and you wear a mask, then you protect yourself from getting those droplets onto other people.